Welcome to the Surgical Breast Oncology Fellowship at St. John's Cancer Institute, formerly the John Wayne Cancer Institute, and Providence St. John's Health Center, located in sunny Santa Monica, California. Our comprehensive breast center is located in the main hospital in the garden level. Check-in is convenient for patients right next to our radiology department. This makes it very easy for patients to get their imaging done and see their provider on the same day. We have multiple exam rooms with ultrasounds available in each room, which allows for bedside diagnostics. Our breast center houses our surgical oncologists, a dedicated breast medical oncologist, and our breast health and high-risk clinics run by our nurse practitioner, who is a dedicated breast specialist. Our workroom houses our nurse navigators and physicians, along with our nurse practitioner, which allows them to work closely together. Our fellows are also located in this room and have their own space and computer to participate actively in patient care.
We spend 3 months between our first and second years on this service. I'm in my second year now, so now I've gotten the flow of how everything works. And it is a robust experience, to say the least. There are more cases than we can cover as a single person on this case, and quite often we have to get other general surgery oncology fellows to step in. I didn't have a great background in true oncoplastic breast surgery in residency. We did things that were called that, but not to the extent that we do here.
If minor procedures need to be performed, we have 2 procedure rooms in our cancer center that allow for outpatient procedures outside of the operating room. Our infusion center, located in our cancer center, has been recently constructed and will be able to house multiple patients undergoing chemotherapy for their breast cancer. Our genetics department is also located in our breast center. Patients can see them as part of the high-risk program or as part of their cancer diagnosis. We love our proximity to our imaging department. We have multiple 3D tomosynthesis mammogram machines along with multiple ultrasounds. We have capabilities for both stereotactic and ultrasound-guided breast biopsies. 2 radiologists are reading films daily and are actively participating in our patient care. One major benefit of our program is there are no radiology residents or fellows competing for biopsies or cases, and our radiologists are committed to training our surgical breast oncology fellows. Our MRI machine is located over at Tower St. John's Imaging and is located only a couple blocks away. This is also where our MRI-guided biopsies take place. Our Multidisciplinary Clinic is an important part of our breast cancer care. We meet Monday mornings and Thursday afternoons. Patients can see a surgical oncologist, a medical oncologist, and a radiation oncologist all at one appointment. They're also able to meet with genetics if needed, along with our research team. We love our collaborative approach to patients, and we meet at each one of these clinics to review imaging, pathology, and come up with a cohesive plan for our patients. We also appreciate the proximity to our radiation oncology department. Patients have access to both of our radiation oncologists with expertise in breast radiation. We have multiple treatment rooms for patients as they're undergoing their radiation treatments. Another unique aspect of our program is our use of intraoperative radiation, which can save carefully selected patients from multiple weeks of radiation with a one-time intraoperative dose of radiation during their breast-conserving surgery. Fellows here have the opportunity to work alongside our pathologists. They are located near the breast center on the garden level. Fellows can review their cases, both benign and malignant, and learn about the nuances of breast pathology. The pathology grossing room and frozen section machines are located right next to the operating rooms and allow for easy communication between the surgeon and pathologist during intraoperative consultations. Operating rooms are located on the 2nd floor of our main hospital. This is where we perform many of our procedures, including our intraoperative radiation therapy. Another unique aspect of our program is that our breast surgical oncologists use oncoplastic techniques during most of their cancer operations. Our surgical oncology fellows have found there's so much exposure to oncoplastic surgery that many are comfortable using oncoplastic techniques once they graduate from this program. While the main OR is generally utilized for our larger cases and those involving IORT, many of our outpatient surgeries take place just across the street at our ambulatory surgery center. The St. John's Cancer Institute, formerly the John Wayne Cancer Institute, is located right across the street from our main hospital. Here we have multiple conference rooms which allow for our fellows conference and education opportunities as well as our research conferences. We also have weekly breast tumor boards that currently remain virtual. The Institute is also where most of our research is conducted. We are proud of the many novel approaches and treatments that have been pioneered here, such as the sentinel lymph node biopsy. The fellows also have an area where they can collaborate with the surgical oncology fellows, as well as their own space for their research and other activities. While we have a dedicated breast medical oncologist in our breast center, we have other medical oncology colleagues who come to our multidisciplinary clinics, and their offices are located conveniently next door.
And I've really enjoyed my time in Southern California. As you can tell, I'm not from here originally. I've now been here a year and a half, and it really has quite a bit to offer as far as restaurants and venues and travel and things of that nature. And if you're going to have to spend another year of training after you get done with your general surgery training, it might as well be somewhere that has a lot to offer.
We are so proud of everything we can do here at St. John's. One of the greatest things about our hospital is really that it has a small community feel with a big academic ability. Located here in beautiful Santa Monica, California, we have great proximity to the beaches, wonderful restaurants, entertainment, and great weather. We are really excited to be educating the next generation of breast surgeons, and we hope to see you in person one day.